So my name's Bianca. I'm the Director of Integrated Care at the North Western Melbourne Primary Health Network. Before I start, I do want to acknowledge the traditional owners of the land on which we meet and pay my respects to elders past, present and emerging. I do also just want to upfront acknowledge Wendy Reid. Wendy was managing this project at the Primary Health Network and did submit this abstract, so I am hoping that I can do her work justice. And I do have a embarrassing photo of Wendy at the end, which she will love. So just a bit of background, I can see some faces from Victoria, but in 2017, Victoria experienced really high demand for winter illness. August of that year actually was the busiest month on record for emergency departments in Victoria, and we had the highest number of influenza notifications. So in response to that, the Department of Health and Human Services released some funding for some time-limited projects that really looked at improving prevention and treatment of influenza, particularly to vulnerable populations through place-based approaches. And this did include those populations that are covered by the National Immunisation Program. And not surprisingly, as with a number of these projects, there was a very short time frame for proposals. So just a little bit about North Western Melbourne Primary Health Network, which is such a mouthful, just in case you don't know. So we're a large metropolitan primary health network in covering Metro Melbourne, or covering the northwest catchment of Metro Melbourne. We cover a large geographical area. As you can see, we've got a really high, 1.7 million people, and it's a really interesting area in that we cover CBD, inner city to large growth corridors in the north and west, and also some regional areas. We've also got huge variation in health status in our PHN catchments. So, variations in socioeconomic status, large populations of culturally and linguistically diverse communities, also a large number of incarcerated people. We do have some large prisons in the area as well, and refugee and asylum seekers. So a little bit about sort of where we fit. So in thinking about our proposal for this funding, we used the data that we had available to really define who is our target cohort in our catchment. So we know that low numbers of men between the ages of 18 and 45 and people with a low socioeconomic status indicated through the data that they were planning to access the flu vaccine. So this information, combined with the data that we have from the PHN's health needs assessment, helped us identify the following at-risk populations that you can see there. But there was a real focus on people experiencing homelessness, people who are accessing outreach health services after hours, men aged between 25 and 55, really in those low socioeconomic areas, and pregnant women and children aged 6 months to 5 years in the Western region, particularly in Wyndham, where there is a large growth corridor and lots of babies being born. So we decided on a nurse-led, patient-centred approach. So tight timelines for this proposal and actually delivering it within timeframes, we needed to mobilise a workforce quickly, and nursing workforce was key to this. The place-based focus of the project really required a bit of an out-of-the-box approach, and potentially not out of the box to you guys, but maybe out of the box for a PHN way of thinking, to be able to reach the hard-to-reach groups. So we know that target population groups of young men and homeless clients that we were trying to access often do not routinely access mainstream health services, and we really wanted to take the services to the target groups to remove the barriers to access. So the aim of the project was to improve influenza vaccination coverage in populations in our region at risk of poor health outcomes. We wanted to increase the awareness of influenza and its consequences and promote key messages regarding infection prevention. So as a commissioning organisation, the North West Melbourne PHN commissioned, I knew I'd get stuck on that, Vaccinate at Work, to purchase the influenza vaccines and implement influenza vaccination clinics that were staffed and managed by nurses and nurse immunisers across 4 targeted programs. So you can see up there we ran 5 clinics in homeless residential services. We ran 5 pop-up clinics in youth-focused after-hours outreach services, 4 clinics in some Bunnings stores in the north and west of Melbourne, and we also ran 2 clinics at a Women's Health Hub, which is a general practice focused on women's health in the west. So the outcomes, we provided a total of 480 vaccinations, and you can see a happy camper taking a seat after his injection in Bunnings, just relaxing in the gardening section there. So you can see also that from the stats, the Bunnings clinics were by far the most popular with 322 vaccinations given. But what was really exciting was the outcomes that we saw in terms of 40% of people vaccinated had never actually had a vaccine, flu vax before. 29% reported having a chronic condition, and 100% of people that completed the survey said they would have the flu vax again this year. It'd be interesting if we could follow up with all of them to see if that actually happened, but a great, at the time, intention to have the vaccine again. So in terms of that graph sort of gives you an outcome in terms of the age and gender breakdown. So you can see from this graph that we did achieve the target for men aged 20 to 55 accessing vaccinations, and this group actually represented 53% of the people we vaccinated. We also had a really good uptake, and we're really excited by the service in the youth services and residential services. And we've actually had one of the residential services contact us recently to see if we're doing this again. But you can see from the graph that we did struggle with the younger cohort that we were hoping for. The clinics at the Women's Health Hub were set up, they have a maternity hospital directly opposite them, and the idea was that the maternity service would actually promote the clinics through their maternity visits, etc. The maternity clinics were really keen to do that, but as with big hospitals, things take time, and unfortunately the time that we had to promote the project meant that we couldn't kind of get that sign-off at the higher level of the hospital, so they weren't able to promote that. It did mean we still had 2 clinics at the Women's Health Hub, and they did still vaccinate 45 people through there, but it certainly didn't give us the population we were expecting, so we didn't get any of the sort of 6 month to sort of less than 5 as we thought we might. Still a good outcome, but interesting that we didn't quite reach that. So we did ask all participants how easy they found accessing the clinics, and it's probably a reflection of the place-based approach, but patients certainly found that it was easy or very easy. Patient satisfaction with clinics, you can see the majority were happy or very happy. There was a few that were very unhappy, and mainly that came, we had 8 people who were disappointed at the Bunnings clinics. They thought that they could get their children vaccinated. We made a decision for the Bunnings that it was an 18 plus cohort, but there were a few people sort of saying that children are really at risk and it would have been really good if they were able to do it. So that sort of relates to the very unhappy. We did have some marketing material, but we clearly didn't make that sort of really clear for everyone, and it was just, some people with different expectations. What was really nice to see is we had some unintended benefits and really nice stories of benefits beyond just the flu vax. So you can see there, for example, John, who was attending a clinic at accommodation service, quite relevant. He had disclosed that he was Hep C positive, but he had so much going on and so many other things that he hadn't actually ever sought treatment for it. While the nurse who was doing the immunisation then sort of got his permission to speak to the nurse at the accommodation service, and she's, I should say, he or she, I'm not sure, is involved in the care planning for John to access. So it's just really good that sitting down in a different environment actually got people talking and disclosing a whole number of things. So there was a few of those, but I just put up a couple of key ones. So in feedback, it's all positive up there, and that's because it all was positive. Apart from what I said, the 8 people that kind of said it was disappointing that children couldn't access, all comments were positive. Apart from those. It's not surprising to anyone here that the comments around the nursing workforce, there was a lot of them. Nurses being fabulous, nice, the injections didn't hurt, so lots of untrust in the nurses providing the vaccinations. But also there were some really great comments about accessing, increasing access for vulnerable populations and the advantage of increasing access by not having the vaccinations only available in a clinical setting, which I thought was really nice. So what are some of the enablers to this project? So certainly being able to assess the needs. All PHNs have to do health needs assessment. It has some really valuable data in there looking at a really local level, what are the needs? So we were able to draw on that, which I think was really good. Relationships was really key. This needed to be pulled together, the proposal really quickly, delivered really quickly. So leveraging organisations that we already have as a PHN relationships with. Some of the services in the outreach youth services and residential services for homeless clients are ones that the PHN fund with some projects, so we already had some relationships we could leverage off and get things in there really quickly. Existing skills, leveraging off the skills of staff and organisations that have already had experience in delivering similar projects, so certainly Vaccinate, and Wendy also in her experience as a nurse immuniser. And the pop-up model was really popular. Taking the clinic to the patients to remove those access barriers actually worked out really well for us. In terms of barriers, the start of this project coincided with an influenza vaccination shortage. So a lot of the promotion we had done, we had to kind of pull back because we didn't have any vaccines to give anyone. But that also meant that the time we had to deliver really reduced the numbers that we thought we were going to be able to get to. As I said, some parents confused about the age limit at the Bunnings stores, and so were upset that the children could not access the service. And as I alluded to before, the tight timeframes meant we really didn't get that push in the maternity setting that we would have liked. We do have commitment from that hospital to do it again in advance, but lessons learnt, they need some time to get things through a hospital system for approval, etc. But goodwill. So in terms of summary, relationships are key. Again, I'm probably not telling you anything, but it was really key for us to be able to set this up so quickly. Nursing workforce can be mobilised quickly and are trusted by the community. And as I said, that came out really clearly in all of the feedback that we got. The nurse-led pop-up clinics provided improved access for many of the vulnerable population groups that we were hoping to do, that we know would not normally access mainstream health services, particularly with a flu vaccination in mind. We got we're really pleased with the coverage of people who had never vaccinated before, which, as I said, was 40%, and 100% intention to vaccinate again this year. The clinics were really well received by the community and had a positive impact on those accessing, but also working within the participating organisations. A lot of the services we went to were really excited, Bunnings particularly, to be able to offering something outside of what they normally would. And one of the comments about Bunnings was it would be great with the flu vax if they started selling bread and milk as well. So you can get anything at Bunnings. But also, I think, as I said, really valuable that the nurse immunisers were able to offer support and advice around other conditions, and we did see some examples of that. And just, what a great outcome. We went in to, vaccinate somebody, and now they're linked in with other treatment services for other health needs. And the clients really trusted the nurses, and that came through with the way they were opening up. And we also thought that this model would be transferable to administer other vaccines if there was a pandemic or the community required urgent vaccination. It can be done quickly. So just in closing, and I think I've raced through, so just some acknowledgements. I certainly want to acknowledge the work of Vaccinate. I also want to acknowledge the partners that we worked with to deliver the pop-up clinics. I also want to send a special shout out to Wendy, who you can see pictured there. Now, Wendy hates this picture. Let me assure you, she did not give a vaccination from that particular angle. That was, just to assure you all, the photographer was from the Herald Sun, so we got some really great publicity about the services with a, traditional-looking tradie type, I guess, but that was for the purposes of the photo. So the vaccination was not given like that, but I did just not want to miss the opportunity to put up a picture of Wendy. Thank you. Oh.
So we do have time for questions. We've got some questions.
Hey, congratulations, fantastic. Are you going to use Bunnings again as a model?
Potential funding is the issue. So the department haven't said whether they're going to do anything again. And as I said, we've had some interest from partners. Bunnings said they would absolutely do it again. And a couple of the homeless residential services have asked again. So it might be something that we would look at funding ourselves.
So I'm just curious, how did you engage Bunnings?
I think it was just I'm trying to recall if someone had a relationship. Jess, I don't know if you know the Bunnings. They did, yeah. It was just a cold call. Yeah, thanks. I just want to check it wasn't. So yeah, it was just contacting central office. Yeah. Well, and they're wanting to do stuff. And
just a quick question. Sorry.
Yes. Oh.
Are they?
Oh, sorry.
Did the patients actually have to pay for the vaccine at all?
No, it was part of the funding that we used the funding to provide the vaccines free of charge. Yeah. Oh, sure, anyone who happened to be there. So, it wasn't like we said, you're not a male between 18 and 25. We had lots of anyone who was at the store could go, yeah.
And how long did you do it for?
So it was all delivered in a kind of a 2 to 3 month window. Yeah, and the Bunnings stores were kind of on a weekend and, yeah. and after hours and things. Thanks. So that was vaccinate, I think. But it's a good question, and I can't confidently answer it, as you can tell by my answer. But I can find that out. Really good point. The continuity, yeah. Yeah. Oh. We haven't looked at that specifically. So the department funded a number of projects, so it would be really hard to kind of say which potentially was our project, but we haven't gone back and looked at that. The department may have. We had to provide a report to the department about the project, but we haven't received anything back as a bit of a summary. This was all the projects that were funded and this was the result. Yeah.
Do you think that the indication for people to all get vaccinated this year or whatever, did you take that as being, if the pop-ups come back out, they'll get vaccinated, or that they're prepared to go and get vaccinated?
Oh, at their answer to intention to do it again. Yeah, look, I think it was a quick sort of post survey that they filled out. So I think it was more about their understanding the importance that it would be good, but I guess, yeah, we didn't delve into where they would plan to have that again. Yeah, but it's a good point. So I was just asked that up the front. No, that's okay. It's really dependent on funding. So this was an opportunity we got through Department of Health and Human Services funding, as did a lot of organisations. They haven't said anything about funding this year, but we have had some increase, and we had such success, it might be something that we look at funding as a PHN potentially. Yeah. Thank you.
Thank you. Let's put it